why PM&R and kind of what maybe culturally might have influenced that. I think um, I didn't have any kind of physician in the family to look up to or to understand. Medical school was a foreign idea to me, and I didn't really even know there were more kinds of doctors than maybe like a general surgeon or your pediatrician. Well, there are really tons of different types. Um, I think understanding culturally and family I've had or friends or just people that you meet within Hispanic or Latinx culture. There's a lot of, well, sometimes there's distrust of the medical community, but there's a lot of wanting to feel better and the importance of making change or doing something positive for someone that they can feel um, in a way that is different than just saying, like, take this insulin so that you don't lose a limb, but instead, do X, Y, or Z thing that's going to make your life better in A, B, or C way. So I think that's part of what started to draw me to PM&R. Um, and a big thing that keeps me going within the field um, and understanding, we run, not we, but the medical school here at Mount Sinai runs a free clinic called EHOP, which is for East Harlem, people that are uninsured or underinsured. The vast majority of those people happen to be Hispanic. Um, and the way that we can get back to them is pretty great. I mean, unfortunately, these are people that have to work 7 days a week. They get injured, and what they need is a solution so that they can get back to their life and their livelihoods. Uh, and we give them that in the best way that we can, and they're appreciative in a way that is, I think, important to them, but also establishes trust within the medical community so that maybe when that next doctor says, hey, take your insulin, that they will listen. Um, I think that's the importance of that cannot be understated. Thanks, everyone, and thanks for listening.
Well, I came into medical school, did not know what PM&R was when I went into medical school. I thought I was going to do something else. In retrospect, I was introduced to PM&R and saw the ability to take care of patients throughout the continuum of care, to take care of patients who've had strokes, knowing that my own grandfather had a stroke. That really was impactful to our family, and he also didn't get the type of care and rehabilitation services that we know that patients need. So how do I use my platform as a Latina PM&R physician to promote diversity and inclusion? Well, I think it's something that, of course, what I stand for, what I think is very important, that we have to look at every patient and know that every patient has a different background. We have to respect those backgrounds. We have to make sure that they feel like they belong in the healthcare setting, whether they be our patients and also the different learners that come into the setting. Make sure that everyone feels that they belong there, that there's a reason for them to be there, and together we're going to improve outcomes.
In terms of advocating has been my sincere concern about the lack of interpreters that are provided to people who don't speak English, and especially for those who are illiterate. And so I feel like it's really a moral imperative for the physician to make sure that patient instructions are provided in the patient's native language, not even whenever possible, period. Period. It is unacceptable for us to complete a visit where a patient doesn't understand what's going on and doesn't and when they don't have their health literacy being promoted. I think that is wrong. And so we can turn that around by providing an interpreter in whatever language they speak, and if they're illiterate, using their phones to record patient instructions and making sure that they can access that video whenever possible, whenever they need to, so that they always have instruction and guidance and they understand clearly what the plan is, when your follow-up is, what the goals are, and that you're available with an interpreter over the phone or in person. And especially at the pharmacy, in order to avoid medication mistakes. There have been more than one instances where I've called the pharmacy and asked them to explain what happened when there are mistakes made, or my patient is just not getting the services that they have a human right to receive. In fact, when I worked at Children's Hospital of Omaha, the Hy-Vee pharmacy came in, the pharmacist came in, and we had like a sit-down meeting, because there was just numerous repeated mistakes. And so we, fortunately, as physicians, have the power to right wrongs and to promote social justice for the underserved.
Difficulties that I found early on was actually in medical school. I think those around me thought I had gotten accepted to medical school just because I was Hispanic, which is silly, right? I did really well on my grades. I did good on my MCAT. I did all the things that everyone needs to do in order to get into medical school. And so I wasn't there just because I was Hispanic. And so along the way, you're going to find people who don't think you belong. And I think one thing that helped me is not to want to prove other people wrong, right? But to prove myself right, to know that I belong in this field and that I can make a difference and that I want to help my Hispanic community. And as long as you have true intentions, you're going to do so well.
So what are some of the challenges that I've been faced as a Hispanic physician? Well, definitely there's been some obvious things that have occurred. Like, I've gone into a patient's room. I've had patients tell me that they already had their room cleaned, that they already gave their order, thinking I was a food services person or someone that cleaned their room, mostly because of unconscious bias and what they consider that a Hispanic woman goes into their hospital room for. But I'm here to educate patients of all types, to let them know that yes, there can be a Latina physician, but it's often not something they see.
As a PM&R trained sports medicine doctor, I think one of the most important aspects of caring for my patients is building that physician-patient relationship. That way, it's that much easier for them to be motivated and engaged in their care. This way, they can take their medications, go to physical therapy, and perform their home exercise program. For some Spanish-speaking patients, this can be a little difficult. But as a Dominican American, I found that I've been able to use language and my background to make it that much more easy to kind of break through and earn that trust and build on that physician-patient relationship so that we can maximize their outcomes.
Because my mom's primarily Spanish-speaking, I've consistently throughout my life noticed as a first-generation American that in our culture, it's not always easy to uncover when a Latino patient doesn't understand, because they may feel that it's disrespectful to ask a practitioner to repeat themselves or to clarify. And so often the answer to all questions in a medical environment is yes. Do you understand? Yes. Do you agree? Yes. Because to say no is just disrespectful. And so because I know that, and I've experienced that personally, and how much it could hurt relationships and just hurt people in general through miscommunication, I really have made it a priority to make patient teaching foremost in my patient visit and also with my patient instructions.
I really love that our culture loves families so much. And so when I see my patients in the hospital, I don't just see them as patients, I see them as someone I deeply care about, as basically an extension of my family, right? And so I take care of my patients like if they were a part of my own family and their extended family. And so it's just a very, very nice to be able to take care of patients in that way and care about them in that way.
When I care for patients, I think about my own background, about having a family with low health literacy. I really think about how a lot of the patients come in and that they need more education, that they're going to rely on family members and extended family members for advice as well. I really want to think about the whole picture holistically, not just the diagnosis, but how it's going to impact their community, and do they have social resources. And I think having that insight, also speaking the language, is going to be something really important and help me make a connection with my patients.
Networking is so important, and you should get started as soon as possible within really any field, but I think within PM&R it's super important. I think great ways to network are to, first of all, reach out to medical students in your medical school and even outside of your medical school, just to see what everyone's doing, what they're preparing for applications, etc. The other thing is to connect with attendings both within your medical school as well as just affiliated hospitals or just any hospitals in general that you can get in contact with their PM&R department. And then lastly, I would say to join a professional organization.
So advice that I would give to Hispanic medical students and early career physicians looking to enter PM&R or any medical field is to be humble. Be humble, ask for help, build a tribe of mentors, ask for help, and especially listen to your inner voice, try to connect with your intuition.
Find yourself a mentor who has been there before, right? There's not that many. I didn't meet my first Hispanic physician until I was in medical school. And he ended up being one of my best mentors. And so I think find someone who's not only gonna mentor you, but sponsor you, right? Talk about you in rooms that you're not in, really will help in the future. And I'm always looking to mentor underrepresented minorities because there's so few of us, and patients want doctors who look like them, right? And so I love getting to take care of my Hispanic patients because I feel like they're part of my family.